there are some people who have very, very severe period cramps. For their 7 days of their periods, they cannot get out of bed, they cannot go to school, they cannot go to work, they need to go to the emergency department and get injections. So these are the group of ladies whom the period pain is actually not normal. There is a disease that causes this period pain. So if you would listen to your mom or your auntie or your grandmother that says wait until you get married then it will disappear, or wait until you get pregnant then it will disappear, it might be a bit too late.
Assalamualaikum and hi everyone, I'm Aisha and today I'm your host for KoPiJom. So today we have a very interesting episode which is titled Beyond Birth, Insight from an Obstetrician and Gynaecologist. And with us today we have Dr Patricia Lim Su-Lyn.
Hi Aisha.
Hi doctor. So today, okay doctor, thank you so much for being here, being with us to share and for your moment here doctor. Doktor boleh cerita sikit tentang diri doktor?
Okay, nama saya Dr Patricia Lim. I'm practicing in Tawakkal Specialist Hospital in Kuala Lumpur. Saya dah di hospital ni, I've been working here for almost 9 years already.
Wow.
Yeah, and personally, I've been a doctor for 21 years and I've been a specialist for 13 years already.
13 years is quite long and many more years to go.
Hopefully, God willing.
Okay, doctor. How about your background for what actually inspired you to become an ONG specialist? Because we all know become an ONG is not 9 to 5 kind of job. You have to stand by, you have to prepare yourself. Even when you sleep, people will kacau you. Kan?
Yes, that's true. Okay, well, it all started like this. Initially, when I was just a normal doctor, just doing my training as house officer and medical officer, my mother already said, you can do anything you want except ONG. But
tercabar. It's a quite challenge for you.
Yeah, because she knows and she has heard that a lot of my family, there's nobody who is a doctor, there's no background, but she knows that it is a challenging field.
Yeah.
But what happened was I wanted to do ophthalmology, which is a specialist in the eye. But when I reported for duty at Selayang Hospital, there was no placement in eye ophthalmology. So it so happened that my mentor then met me in the office and said, why not you join ONG? First, try it out. And now you see, here I am.
Okay.
Yes.
Okay. It's a quite interesting story actually, how you switch from the ophthalmologist into the gynecologist.
Yes.
Yeah. Okay, so when it comes to ONG, actually, people will assume it's just about delivering babies. But actually it's not, is it?
Yeah, it's not. So that's why there's obstetrics and gynecology. So obstetrics is the delivering part, the mother getting pregnant, taking, and then the baby and the delivery. Whereas gynecology is all about women's health. So from the time where you reach puberty, you start your first periods, to after that you get married, you want to have a child, and then after that you have your baby, and after that you maybe have period problems, and then you may reach perimenopausal and then menopause. So we cover the entire lifespan of a lady.
Yeah. So let's talk about the period pain macam doktor kata tadi. Daripada kita kecil, kita dimomokkan kadang-kadang period pain ni dia akan hilang ataupun it will disappear with finger of tips, yang lepas kahwin ataupun childbirth benda tu akan pergi.
Yes. So the myth is that if you have period pains, a lot of our mothers or our aunties or our grandmothers will say, "Ayah, don't worry, it will disappear after you get married." So that has been the belief in the public, but it's actually not entirely correct. So there is normal period pains that usually happens on the time where you have heavy bleeding. So what happens is when you have heavy bleeding, the uterus will try to get rid of the big clots and it will cause a bit of spasm. So that is normal, but there are some people who have very, very severe period cramps. For their 7 days of their periods, they cannot get out of bed, they cannot go to school, they cannot go to work, they need to go to the emergency department and get injections. So these are the group of ladies whom the period pain is actually not normal. There is a disease that causes this period pain. So if you would listen to your mom or your auntie or your grandmother that says wait until you get married, then it will disappear, or wait until you get pregnant, then it will disappear, it might be a bit too late. Why? Because if you have a disease called endometriosis, it will continue to progress every month when you have periods, and this disease can destroy your fallopian tubes and your pelvic organs. So if you wait until you have your baby, you might not even get pregnant, because majority of ladies who are having problems conceiving, tak dapat nak mengandung, when they come for checkup, then only they find out they have endometriosis. So if we think that period cramps will disappear after marriage or after you get pregnant, that is quite dangerous to believe, because the disease will progress and you might actually not know that your fallopian tubes or your pelvic organs are already actually destroyed.
I see. So actually it's quite safe for me to say that actually from the period pain atau period cramp tu, dia akan lead to the fertility punya issue.
Not all period pains, but if you have something like I said, it is abnormal, you can't get out of bed, it's every month you're in pain, it's lasting more than 2 days, then you should come and see a specialist.
Okay, doctor. What is a common myth of the fertility or infertility?
Okay, common myths on infertility. Actually, there's no one. I will give you maybe 3. So the first one is everybody thinks it's the woman's fault. All right. So if you talk about maybe amongst families and all that, like, you know, pressure from your mother-in-law or your mother, oh, kenapa you still not getting pregnant and everything, everybody will say, oh, it's the lady's fault, go and get her checked out. But actually that is wrong. Majority of the cases of infertility is actually mixed infertility. So it is male factor and female factor. So it's not necessarily just the female. The second myth is that everybody thinks that age is one of the cause. I would say in a way age is a factor, but it's not a cause. I mean, nowadays you see ladies are more career minded, so they are delaying their trying to conceive period to later because they want to establish themselves in the employment field, right? Age is a factor because, as you know, ladies, we are born with only certain amount of eggs, and as we age, these eggs will reduce. But it is not the only cause. So that is one of the myths. The third myth is they said that stress is a major cause of
I heard that.
infertility. It is, but it's not the only. There are a lot of other causes of infertility. I mean, I think if you work as a doctor or if you work as a administrator, that you have different amounts of stress.
Betul.
It may be one of the factor, but it is not the main cause of infertility. So for those who have been trying to conceive, that I know that there is a criteria that if you're less than 35 years, you have to try for 2 years, and if you're 35 years old and above, you have to try for 6 months. But if you don't want to, you want to get input on whether you're healthy enough to get pregnant, what we call preconception counseling, or is there anything wrong, you just want to make sure you are healthy and your partner is healthy, no problem. You can always go to a fertility specialist or even a gynecologist who can carry out any of these tests and make sure that everything is in order.
So for the people ataupun couple yang ada problem macam ni, they are seeking for the help or treatment to conceive. So actually apa yang treatment yang doktor akan bagi?
So the most important thing that I will ask is usually number one, that they are actively trying. Actively trying means the husband and wife are staying together, because sometimes you have a long distance relationship.
PJJ.
Yes. So your
Okay.
husband is not always with you, and by the time when your husband is back with you, that is not your fertile period. So you cannot actually say you're actively trying. So firstly is I will inquire about their background. Are they staying together? Are they actively having sex to, and how's the cycle of the lady? Is the period cycle regular? If the cycle is regular, then we presume that she's actually ovulating. And then whether they personally, the wife and the husband, are they having any medical issues? If the wife or the husband has medical issues, then maybe this is the reason, especially for the lady. If she's diabetic, or she has high blood pressure, we want to make sure that her medical condition is optimized. Then okay, if it's really established that yes, they live together, they've been trying to conceive for say maybe 1 year, 2 years, and still nothing, then we carry out investigation. So usually we will check the hormone levels for the lady, and then we also do what we call a tubal patency test. So either it is done by hysterosalpingogram. I suppose people have heard HSG. So it's basically to see whether your tubes are open so that the fallopian tube can catch the egg every month. And this is done usually in the X-ray department. What they do is they insert a dye through the cervix that goes inside the uterus, and then they take a few X-ray shots. So logically, the dye will go through, and if your tubes are open, you will see the spillage. So that is done for the ladies. Then for the men, we usually check their sperm count. Of course, I will also ask about their occupation, because certain occupation has a higher risk of lower sperm count.
How can it?
For example, if you are always exposed to heat, like for example, lorry drivers, they sit on when they drive, which is hot because the engine is down there. So that could be one reason for low sperm count. Second is also smoking, vaping. These are known to reduce your sperm count. Yeah. So so I would usually ask, and we will usually recommend the men to try to reduce and stop, because the moment you reduce and stop, the quality of the sperm and the quantity of the sperm will increase.
I see. So encourage actually for the men, they are better stop for smoking.
Yes.
Yeah. Okay. Okay, doktor. During pregnancy kan doktor kan, is it necessary for a mother to do the detailed scan?
Okay, good question. Actually, what is an ultrasound lah? Okay, so an ultrasound is actually a test that we use sound waves to get an image of what's happening inside.
Okay.
So typically we do it for pregnant ladies sebab we want to monitor the baby, the growth. So we do it in the first trimester. Number one is to confirm that that lady is pregnant.
Okay.
And to make sure that either there's one baby or two babies.
Or three
okay,
babies.
because there might be twins. And then to make sure that the pregnancy is in the uterus. So in the first trimester and in the early scan, what we do is we want to make sure that the baby is the lady is pregnant, and it's either one or two, and it's inside the uterus. And of course, if there's any other abnormality, sometimes they have fibroids and they have cysts and they're also pregnant. And then the most important thing in the first trimester is we want to date the pregnancy. Because if I ask you, Aisyah, bila your last period, you like, ayalah, tak ingat lah, or something,
bulan lepas
right?
je, doktor, bulan lepas.
Adalah last month datang, tapi this month I know tak datang. So sometimes you cannot recall when is your period, so we need to date the pregnancy. Because it's very important. Sebab the pregnancy, as we monitor, dating in the early trimester, then we can see whether is your baby growing big or is your baby too small, not growing. So that's why we want to date the pregnancy, and it's best done in the first trimester. Then in the second trimester, we do scans like what you say, detailed scan is, in the first trimester, we also do something called nuchal translucency. That is the thickness of the neck.
Okay.
This is usually done 11 to 13 weeks
Okay.
to look for risk factors like those with a very thick nuchal translucency. Sometimes their baby are at higher risk for Down syndrome, or their baby is at higher risk for other abnormalities. But for Down syndrome, we also have another blood test that we can confirm it. So first trimester, the scan is for this purpose. Second trimester, we do something called detailed scan, detailed anomaly scan. For the public, usually they say, oh, it's 3D scan, it's 4D scan or 5D.
Betul.
They want the gambar yang cantik so that they can post on their social media or, keep in their album. But actually, for us doctors, it's important to do a detailed scan, and the timing is very important. It's about 20 to 24 weeks.
Okay.
That is where all the organs are formed already. So we want to know if your baby is healthy, brain is normal, heart is normal. For me personally, I want to make sure that the baby is free of any abnormalities, is healthy, so that you want to know which hospital you can deliver in. If let's say your baby has a major abnormality in the heart, maybe you want to deliver in a bigger hospital because they have all the equipment.
Yes.
So there are some where they have maybe abnormality of the septum in the heart. So you want, once the baby is delivered, you want the pediatric team to be ready. So this is also why you should do a detailed scan. Not that so that you have the 4D and 5D. That is the bonus. But you want to make sure that your baby is healthy. Then after the second trimester, the scans that we follow is basically for growth. We want to make sure your baby is growing. In the third trimester, after 28 weeks, we want to see your placenta. Is the position really an upper segment placenta? Because if your placenta is low, placenta previa, you cannot deliver normal. And then in the third trimester also, we want to know the position of your baby. If your baby has the head down, then there's no problem. You can go for a normal delivery. If your baby is breech or transverse, then you can't deliver by a vaginal delivery. So at every period of time, your scans are there for a reason. In Malaysia, we are quite spoiled and we are quite lucky. When you go to private, you get your scan done every visit. But actually, in countries or even in klinik kesihatan, you don't get your scan at every time. So they concentrate on the first scan where they date you. They concentrate on then the detailed scan. But I think in the government setting, only if you're high risk, then they ask you to do a detailed scan. And then they do another scan maybe in the third trimester for your placenta, locally, the position of your placenta and the position of the baby. But if in private, we're very lucky. All obstetricians usually have their own scan machines, and
So
you
every time, every visit.
And I'm sure as a mother, you would also want to see and hear your baby's heartbeat. Like for me, when I was pregnant with my first child, I was in Australia. They only do 3 scans. First trimester, your second trimester, your detailed scan, and your third trimester. So the rest of the time, you don't get to hear your baby. You don't get to see your baby.
How's the baby?
You don't really know. All you have is that, okay, my baby's kicking me, but that's it. There's no scan, So I was like, I feel that the patients in Malaysia are so lucky because every visit you get your scan, you get to see your baby.
It's actually the memorable. Okay. How about PCOS, doctor? I really want to know because PCOS is macam selalu orang cakap pasal PCOS, but actually kita tak tahu pun actually apa tu PCOS sebenarnya.
PCOS, the full name is actually polycystic ovarian syndrome.
Okay.
But the person who named this disease actually was describing what we see on the ultrasound.
Okay.
So on the ultrasound, we actually see small kind of eggs, or we don't even call it cyst, but that's why people mistaken. They think the disease is polycystic. There's a cyst in the name, so they think they have a lot of cysts. But actually, polycystic ovarian syndrome or PCOS is actually a hormonal imbalance. So in our body, we have female hormones and we have some amount of male hormones. But ladies who have PCOS or PCOS, their male hormones are a bit high.
Okay.
So they have symptoms like irregular periods. They have symptoms like hair over their upper lip. Sometimes they also have they have balding a bit, which follows the male balding kind of pattern. And they also have acne.
Oh, I see.
So PCOS is basically an easy way to think about it is a hormonal imbalance. But it has long-term implications on a lady because, number one, we don't know when that lady actually ovulates. So when she gets married and tries to conceive, that could be a challenge. Secondly, is a lot of the ladies who have PCOS are usually overweight or obese. So their body is also in a state of insulin resistance. Most of the time when we see this kind of patients, we advise them to lose weight, go back to a normal BMI of maybe 22 to 23 and to exercise. Because ladies who also have PCOS, later on they have a risk of what we call metabolic syndrome. Metabolic syndrome means they have diabetes, heart disease, high cholesterol. So this will affect their future.
I can
So that's why we emphasize that they have to lose their weight and make it a daily habit, not just lose the weight and then after that go back to their original obese state and overweight state. So that is the myth behind PCOS. It's not that you have a lot of cysts, but basically you have a hormonal imbalance, and it is lifelong. It is not something that will disappear, but you can control it. So if you control it and you bring your BMI down, you're maintaining, exercising, and keeping a good, healthy lifestyle, then the disease can be controlled.
Control but not disappear.
No, it's something like diabetes. If you have it, it's a lifelong disease, but you keep it under control.
I see. Okay. So it will affect for the fertility, tak, doctor?
Yes, because ladies who have PCOS, they don't ovulate regularly. So when it's time to actually try for a baby, they do not ovulate regularly. So it's difficult to time when to actually have intercourse and when is the good timing to try for the baby. So that is the challenge.
Okay. So I can relate to the fertility because of current trend is when the couple married, they are try to conceive at the early stage. So do you have any advice, tak, doctor, ataupun actually when you supposed to seeking for help if you are trying to conceive?
Okay, so in national guidelines, usually we take a cut-off point of 35 years. So basically, if you are less than 35 years, we want you to try on your own. That means regular unprotected sexual intercourse for 2 years. You should be able to conceive. 90% of couples by the second year will be able to conceive if there's nothing wrong. But if you are above 35 years old, because we are concerned about the lady's age, we encourage you to try on your own for 6 months. If by 6 months you've been trying regularly and you are not successful, then we urge you to go and see a fertility specialist.
Seeking for help lah.
Yes.
Yeah. Okay. So because it's like a trend sekarang. Young couple kahwin tak dapat, diorang dah start risau. And okay. Ada tak, doktor? Because saya percaya doktor dah melalui pengalaman bersalin yang sangat banyak, kan? Do you have any special moments yang doktor rasa it will stay with you forever, ataupun any funny moments yang memang doktor fikir macam tak boleh lupa lah sampai bila?
I think all the deliveries are actually very special for everybody, and for me it brings a lot of joy to see that couple are happy to welcome their newborn, whether it's their first child or it's their third child. It's very rewarding. That's the part about ONG that I really like. Although it's very stressful, but it's also very rewarding when you see the couple trying for so long and they finally get pregnant and they deliver a healthy baby.
That's good. There have any funny moment tak, doktor? Ataupun
Nothing in particular, but I actually recall one patient that has been trying for many, many years. They went through a lot of treatment and everything, and finally they actually conceived on their own. And it was nice that they came back to continue their pregnancy with me. And then when they delivered, it was a very special moment for them. So, but I would say for everybody, birth of a child is always a special moment. Yeah.
I agree with you.
There is a couple of funny things that have. It's a job hazard lah. I would say it's not funny, but it's like a job hazard. So, when I was working in my previous hospital, right? So the patient, you know, when in labour kan sakit kan. Aisyah ingat, right? Okay. So what happened was the most common one is they will start screaming at the husband, and of course, you know, poor husband will have to tahan, so the wife is in pain. But there was this lady that she kept grabbing onto me and the nurses and all that, and the problem was her nails was so long. So jadi right, lepas tu kita tahan aje lah, tapi lepas tu nampak kita kena
kesan dia tu,
kena
scratching itu.
cakar, right? That's one thing. Another thing is usually we don't recommend for the mother to eat so heavy.
Oh, okay.
Although some people will say kalau I tak makan macam mana I ada energy untuk push.
Betul.
So the reasoning is sometimes kalau you makan terlampau banyak, the time when it's time to push, plus some of the medications that we give you may cause you to want to vomit. So I was trying to conduct the baby, deliver the baby dekat bawah, but the patients tiba-tiba started vomiting, sampai vomiting tu terkena dekat my face at that time.
Pakai facial tak?
Tak ada facial.
Okay.
Nasib baik pakai mask.
Okay.
But previously before COVID, sometimes we don't even wear mask, you know.
Yeah.
So that was like one of the job hazards lah that you can you just need to be prepared lah
For everything. Yalah, nak prepare, nak sambut baby, suddenly vomiting.
Yes.
Alright, okay. I can understand that. So, doktor, ada lagi satu isu yang paling is a hot topic regarding a cheat code, which is we call it epidural.
You mean the husband says epidural is a cheat code?
Yeah.
Actually, going through labor pain is something that is somebody said is almost equivalent to like a marathon or even more. But the pain we cannot describe. The pain is definitely unbearable.
Yes.
For some, maybe they have higher threshold. For some, they don't have. But we cannot say epidural is a cheat code, because even with epidural, you still feel. Kan dekat akhir-akhir, you still feel, right? So, I would say labeling epidural as a cheat code is not correct, and I think it is very condescending to the mother, especially the pregnant lady who has carried your baby for like how many months, has gone through back pain, sleeping, discomfort and everything, and then not only that, has to go through labor and labor pain. The least that you should at least encourage her is for epidural, because epidural does not guarantee that you will deliver easily, faster, or
without any pain.
Yeah, or without any pain. It's just one way of helping the mother go through this stressful situation, which is very painful. And also one way that she can also have a good memory out of delivering this baby.
So, instead of asyik ingat yang kesakitan tu kan.
Because we always have that trauma then that of pain.
Yes, the trauma will stay there forever.
Yeah.
Betul tak?
Exactly.
Dengar tu Jangan cuba-cuba untuk panggil cheat code lagi. Okay, so doktor, ada tak advice untuk husband who yang accompany wife dekat dalam labor room tu sendiri? Sebab sometimes
pakai lengan panjang. Make sure your wife cut her nails. No, I think just be supportive. Basically, all she wants to feel is that you understand the pain and the sacrifice that she's going through. This is like a memory that both of you want to share together. So just be a supportive husband. She may want you to rub her back, or she may want you to buy some of her comfort food and things like that. So just layan. After all, she's going through the most painful time of her life, and she will be giving birth to your child.
Betul. Appreciate your wife.
Yes.
Is it? It's
Wife Appreciation Day.
Yes. We will call it is one day. All right. Okay, doctor. So I'm going to talk about KPJ health system. So do you have any advice for the future medical student or the person who are going tuning into the ONG specialist?
Training for ONG?
Yeah.
Well, the most important thing is make sure you are passionate about doing obstetrics and gynecology, because especially in the private sector, like what Aisha said earlier, you are basically on call every day, 24/7. Although you are rostered for the gynecology part, but obstetrics, whenever your patient comes at any time and any place, you cannot time when the delivery will happen. You will have to be available for that delivery. So you need to be passionate, and you need to be willing to sacrifice that, especially if you're a lady, you have family, you have kids. It will be quite challenging. My kids always say, "Mommy, you are not on leave." Even though I'm on leave and I'm in KL, they will say that you're not on leave unless I leave the country. Because even if I'm on leave and I'm in KL and the hospital calls me, I will also still answer and attend to the delivery.
Still
Yes.
kan, doktor. So it's I must say that actually dia pekerjaan yang sangat mulia tau. For me, I'm very excited to see ONG, because ONG ni bukan semua orang boleh buat.
It's true. So if you have the gift and you have the passion, then go for it. But be prepared that I travel everywhere most of the time with 2 cars, because in case I have to run somewhere, I don't really go and watch movies, because halfway through you get a call. So that's the
please come to the hospital now.
Yes. So there are things that you need to sacrifice, but if you love your job like I do, then that's a sacrifice worth giving up for.
Okay. Among the sacrifice that you did before, doktor kan, ada tak yang toughest challenge yang doktor encounter?
I think the challenge is because especially for obstetrics, we are dealing with 2 lives. So if you are like a physician, you're just taking care of one patient. If you're a surgeon, you're just taking care of one patient. But as an obstetrician, we are taking care of mother and baby. So the stress is really, really high. We want mother to be healthy and also the baby. There are some conditions where mother is not healthy, and we also need to make sure that in that unhealthy state, how can we bring her to a period of time where we can deliver the baby safely. So it is a challenging discipline, but it is something where you have a bits of everything. So for example, if you're a physician, you probably diagnose, treat the patient. If you're a surgeon, you diagnose and you operate. But as an obstetrician, I have all of this. So I have a bit of physician in there, I have a bit of a surgeon, because I also operate. So it's a discipline that you have best of both worlds.
Mulianya, saya sangat suka. So do you have any advice for the future ONG specialists?
Make sure you listen to your mother. I should have. No, but if you're really interested, make sure you have some exposure, because a lot of the time when we in medical school or when we are training as house officer, we don't really see the true sacrifice and the true picture of being an obstetrician and gynecologist, because we maybe just do one part of it when we are training. We don't do everything. So if you're interested, please do. We need more obstetricians and gynecologists. But make sure you expose yourself. Maybe go and do some attachment, or speak to your ONG and ask them what's their challenges, and see if that aligns with what you also think you can do.
I think that's it for today, doctor. So thank you so much for joining us in KoPiJom. So do you have any other words, the last word you would say to the viewers?
First of all, thank you for tuning in and joining us in our KoPiJom Podcast. To all pregnant mothers out there, I wish you all the best in your delivery. To all those ladies who are going through some sort of gynecological problem, don't be shy. Don't think that period pains are normal. Don't normalize period pains. If you do have an issue, go and see your friendly gynecologist. And if you are aspiring to be an obstetrician and gynecologist, don't let me dissuade you. There's a lot of advantages from being an ONG specialist. Please go ahead, chase your dreams, and take care.
All right. Okay. That's all for today. I will see you for the next episode. Bye.
Bye.